Hello, my name is Anne Sattler. I am a physiotherapist, Pilates instructor for rehabilitation and SPINEFITTER instructor. I work with the SPINEFITTER both in the therapeutic area, so really with the SPINEFITTER on the patient in the practice and give him things to take home, but also in personal training or group Pilates. There you can use the SPINEFITTER wonderfully. The SPINEFITTER was developed by osteopaths and physiotherapists to really give our patients a very safe, simple tool, i.e. aid to take home so that they can mobilize themselves independently and safely at home. That is the first point that the SPINEFITTER makes possible, to release tensions in the musculature and adhesions in the fasciae through small movement sequences on the SPINEFITTER. And also, when we have mobilized and released, to stabilize this new body perception and body erection in order to strengthen the small, deep-seated muscles. If we now take a look at the SPINEFITTER and our spine, how does the patient or the potential buyer you have in your houses lie on it? The SPINEFITTER has a hollow from top to bottom in which the spinous processes, i.e. the bony points here at the back of the spine, which you can feel quite well yourself, can sink in, and the balls then exert pressure at specific points in the tissue near the spine. So all the structures that run along the spine, be it the muscles or the fascia, the connective tissue, are treated and these tensions are released. If we now imagine that we do small movements on the SPINEFITTER, that is small light exercises, and we now take, for example, the rolling upwards on the SPINEFITTER, then we see that here the small intervertebral joints, that is between the upper and lower vertebrae, the joints can open, mobilize, and I have mechanical stimulation sets through the balls, and they make it possible for me to become more mobile in my facet joints while rolling up and down to mobilize myself, and I can do that quite safely and easily at home, and that's what makes it so attractive for my patients in this case to buy the SPINEFITTER, because they can help themselves quite easily with simple movement sequences. What kind of material is it made of? It's very flexible. It is a high-quality integral foam that is completely filled with foam. And while this foam dries, a skin is formed that is completely closed, which means that no moisture can penetrate and damage the material in any way. Now I have said that it is very flexible. It is, and can therefore, of course, also really super adapt to the spine individually. Nevertheless, we are allowed to bend it a little bit, but we are not allowed to fold it. This is very important because at some point the material will get tired and it will break there. Also, during the exercises, don't bend it or extremely tug and pull on it. Who is it actually for now? It's not just for people who come to me for therapy now, but in principle for everyone who suffers from back pain. And nowadays, who is not, I would say that everyone who comes into your house is a potential buyer for the SPINEFITTER. So all people who, for example, suffer from normal back pain or tension, whether it is due to the one-sided load at work or actually any events that were once, and they have thus retained back pain, so chronic back pain. What's also great to treat or improve with the SPINEFITTER is when athletes come to your house, and maybe with some other ankle injury, for example, the rehabilitation goes faster. That is to get them back in shape faster between two training sessions, or just to improve their mobility, to improve the particular sport, the movement that they have to do in the particular sport, For example, playing tennis, where I need a much moved spine, well in rotation and flexion, so flexion mobilized spine, but also golf and soccer and so on. I need my trunk mobile and just, but also stable. Otherwise, of course, the spine fitter is often found in physiotherapy practices. That is, the therapists work with the patients on it, show them the exercise, and then they are supposed to buy it for themselves to do these exercises at home and thus support the therapy. So, even though I have now said that in principle the spine fitter is a wonderful aid for anyone who wants to go through life active and mobile, we still have restrictions on clinical pictures, i.e. contraindications, which do not belong on the spine fitter. This definitely includes an acute herniated disc. That is, really acute means that they have acute symptoms. For example, they have radiation and so on. I'm not talking about the fact that after 3 months, which I would then call chronic, then they are allowed to practice on the spine fitter and of course with it. Nevertheless, in such a case, I would do it together with the therapist and not just send the people on it. Because of course it also depends on how is this herniated disc individually, how is the pain symptomatology. Next we have osteoporosis. Osteoporosis, we mobilize with pressure in flexion. So in flexion, that means for osteoporosis patients, this is definitely a contraindication. We have fibromyalgia patients who have this pain problem between the tendon muscle transition, and we don't want to have even more pressure, even more compression on this structure. So that's also a contraindication for us. Next is pregnancy. Pregnancy counts as a contraindication for us because we don't have any data on how the spine fitter affects existing pregnancy. And that's why we take pregnancy as a contraindication to it. All acute inflammations in the area where I want to work with the spine fitter are a contraindication. I can work on the spine, of course, if I have inflammation at the ankle. Maybe that would even be nice because I take a little bit of tension centrally and drive people down a little bit centrally from the pain symptomatology. Then another next issue is medications, blood thinning medications or anticoagulant medications. Simply because we have this punctate pressure that I have on the structures from the balls, there can be bleeding. We want to avoid that at all costs. Next, I would like to talk about who the spine fitter is actually for, that is the target groups. I can only say that it is good for everyone because we all want to be mobile, agile, and active in the world. That means that we all often have too much one-sided strain in our everyday lives, whether it's a sedentary job or, of course, standing jobs at work, where I simply put too much strain on one side in one direction of movement. And this leads to a dysfunction of my muscles. And then it simply does me good to become more mobile at home, to help myself, but also to release these tense muscles. Then, of course, we have athletes who benefit greatly from the spine fitter, who then regenerate on the spine fitter between their training sessions, so to speak. This means that they boost their metabolism again in these areas. They are more quickly fit again for their training session. They can keep themselves mobile. But even if they have to make certain movements, such as the tennis player who needs many rotations in the thoracic spine, who needs a mobile shoulder, can support this with the spine fitter in order to then become better in his specific sport. But of course, not only for tennis players, but of course also soccer players. We have the golf sector. We have gymnasts who perhaps relax on the spine fitter or just improve their mobility. So there are no limits. Everyone can look individually at what I need specifically in my sport and then adapt my exercises on the SpineFitter. I like to use it for therapeutic purposes, as I do to work out exercises with my patients in therapy, which they can then do at home to support my therapy, for example, manual therapy, where I try to make the patient more mobile in certain areas with the exercises that I give them. The people get better much faster, and they are, of course, very satisfied because they can easily help themselves at home. How often do I use the SpineFitter for it to work effectively? Less than we think. We always say every other day for a maximum of 10 to 12 or 15 minutes for several exercises. That means I don't stay in one position for 12 to 15 minutes, but I do multiple movements on the SpineFitter for that amount of time. Each exercise that I do on there, I do like 4 to 6 times, and then I move on to the next exercise. And with this application amplitude, we have the best success also in our clinical study, which we did just over 6 weeks, where we found out that the patients became much more flexible, especially in the thoracic spine, in the cervical spine, and in the shoulders, and the pain symptoms became much better. In the following video, I would like to show you now 3 quite good exercises to show really quickly what the SpineFitter can do and how good it feels to exercise on the SpineFitter. And since I know you don't have a lot of time in your houses either, when people come in and you put them on this SpineFitter, we've reduced that to 3 really concise, quick exercises. All the other exercises, you can find them at spinefitter.com. These are 12 free exercise videos that cover all areas of the body, and you can then give those to your clients. You can watch them for free at any time on our homepage. Then I ask you to sit on the SpineFitter. The most important thing at the beginning is the positioning. How do I lie correctly on the SpineFitter? And I always instruct this in such a way that I really let them sit all the way down on the last balls. Then roll off once in the supine position. And then most of them end up with their head too far up. That's why I ask you to slide down a bit more. So that our sacrum rests well on the SpineFitter and the head is well positioned on top of the last balls. Now it's a little bit borderline with him. We could just take our extension kit already there. This is the connector. With that, I can extend it wonderfully. And our SpineFitter Mini, then we have 4 more balls on the SpineFitter, and so also for all the people who are taller. Can you slide up a little bit now? Those who are taller from 183, 85 are then well supplied with length on the SpineFitter. As a first exercise, you may take your arms up to the ceiling, let the shoulder blades sink very loosely and the palms look at each other, and then perform a circle with the shoulder blades gladly in the other direction, so that the shoulder blades can sink really deep next to the balls. And you can do a circle at the edge of the shoulder blades. And to get to these structures, which are quite often firm and tense, a nice massage effect. From this shoulder plate circle, you may then go upwards into the large arm circles, i.e. over the head and over the side, back again and upwards again, and back up again. These circles, as mentioned earlier, are done 4 to 6 times to start and then can be increased as needed depending on how long I have been practicing with the SpineFitter. On the next circle, when you land back at the top of the head, you may take your hands behind your head at times. Properly support the head well like a hammock, and from here roll upwards with the upper body vertebra by vertebra. Then we hold at the top, close the elbows a bit, and go with pressure vertebra by vertebra back down into the supine position, and then roll up directly with the pelvis into the shoulder bridge, just to between the shoulder blades and vertebra by vertebra deep again. When the pelvis comes back up, the upper body comes back up, so we have a combination movement like that, mobilizing not only the thoracic spine as we go up and down, but just the lumbar spine and the transition between the thoracic and lumbar spine. Do that again from the top. Then you may roll back down. Lay down, relax your arms. Make sure that the potential buyers really only repeat that 4 to 6 times at first, and then see how does my body react to the stimuli that I then get next to the spine. Further exercise variations with the SpineFitter now in a standing position where it's about our balance, our equilibrium, our proprioception, that is, how are my joints in space, this perception. We do that with our foot when we're standing. And again, it's about also treating the structures, our fascia under the foot, again to increase the perception, but also to release adhesions and tensions, and also to mobilize these small joints in the foot. For this purpose, I would like to ask you to get on the SpineFitter with both feet and simply walk the length. Come to me at the end of the SpineFitter, walk completely off and slowly back again. And then you can take more of the midfoot area when you walk down, or just the heel. Exactly. Come back again, and also more maybe just the forefoot, so that I've worked through all areas of my foot and of the sole of my foot. You may go once more to the other end. That's right, and come back down completely. And turn once so that you're facing the SpineFitter. Now I've prepared my structures in the foot a little bit, also woke them up, increased my awareness, and now I can go into balance and equilibrium. That means you can put one foot lengthwise on the SpineFitter, and now you balance to the end of the SpineFitter and then go backwards to the end of the SpineFitter. Do this one more time. Because of the unstable support surface, he now has to constantly compensate for his deep-seated muscles. That means we have strengthening in that area, we have balance training, and we have this how are my joints in space topic, proprioception in therapy, also very important and very big as the foreground. Then you can go back to the end. Then you can safely place your right leg on the SpineFitter, calmly a little bit more in the middle. Your gaze may be parallel to the floor, and then you lift your free leg up, just up into the knee lift, and push it back once again. And so now we can play quite freely with what the free leg is doing. You may also go down and lift it sideways once, here to the side. I could make circles. There you can let your imagination run free in order to challenge him here once again so properly on the SpineFitter that he must balance well. You can see beautifully here on his ankle and on his thigh that he must do something properly. Then you may dismount. Of course, the side change would come when you're practicing with your patients or your clients. For the next exercise, I'm going to rotate the SpineFitter to show that a little bit better from this direction. You may put one foot on a ball now, and the other free leg will take a big step over the SpineFitter. and bend a little bit. You may bend a little bit. Now, I would like to hear in the back that the heel stays low, that we have a stretch in the superficial bath muscles here first. And if you now bend the knee behind, then we get to the deep structures, to the deep bathing muscle, the soleus. Then we also have the possibility to stretch it. And you could also stretch and bend the knee to go into a dynamic stretch. At the same time, I have a beautiful mobilization in the ankle. And by having my foot on a ball, a stretching of my transverse arch. Thank you. And you get to take a step forward to safely resolve the exercise again. In this video, I want to share with you 2 exercises that you can do with our trigger tool. The trigger tool is for when I want to treat an area of pain, trigger points, pain points more intensely again. The nice thing about the trigger tool is that I can put that anywhere in any hole from the spine fitter, so I can individually address my pain points myself. Now I'll take an area for you that I think fits quite well. You may first position yourself again on the spine fitter. A little bit further down, that's right. You take your hands directly behind your head and roll yourself. Vertebra by vertebra, slowly. Then it's allowed to slowly move into this trigger tool and also right back out, so that I work dynamically into this pain point and also go directly out again, and don't stay too long in this pain area. You may roll up again. For the static exercise, I go a little bit higher for you. I don't think that's as intense. You may position yourself again, hands behind your head, feet up, roll in, vertebra by vertebra, and now he may lay down completely on the tool. And maybe you have to slide down a little bit so that the head is also well supported. Exactly. With this static exercise, this trigger tool treatment, he can simply lie down in a relaxed position and take 4 to 6 breaths at the beginning to let himself sink in a bit and get used to the device, to the tool. And then I would go right back out again, because the stimulus, the treatment with the trigger tool, is of course much more intensive than the application without the tool only on the spine fitter. To see all the applications again, there is a video about the trigger tool. There I can also see other areas, for example the lumbar area, which I can also reach wonderfully with the trigger tool in a different starting position. The spine fitter at Sissel is available in 4 colors. We have lined them up here once to make it clearer. These 4 colors are not different degrees of hardness. They all have the same degree of hardness. It comes in the packaging, in this box. And then on this box, you can see the color directly. You don't have to look inside first, it's made clear what color is in the box. When you open this box, the spine fitter is on a carrying strap. That means it's actually to carry that. The important thing is that before users use it, they take it off and they don't practice with the strap. Then we have different ways to extend our spine fitter once. This is our extension kit. The extension kit is our connector and our mini. The connector is to connect the spine fitter and the mini together, and I can clip that on whichever end I want. So I have 4 more balls, and I have a greater length to practice on the spine fitter, which is recommended for all people from about 183, that the head and the sacrum are still optimally supported. At the same time, I can take the mini as my own tool. I can take it with me when I travel, for example. And then I can do my arm circles, my shoulder circles, the exercises that you know from the video with the exercises wonderfully on the mini as well, in order to have something with me for the trip as well. As the next extension of our SPINEFITTER, I would like to show you our trigger tool. The trigger tool can be plugged in just as easily as the connector, individually in each hole in the SPINEFITTER, and is for trigger point treatment. That is, I can now select individually where is my pain area located, which trigger points, which pain points I want to treat, and can thus place the trigger tool individually and help myself with my pain best. As another accessory, I would like to introduce you to our linum. The linum comes in two different designs. We have one in the cotton cover. The linum is heated either in the microwave or in the oven. The linum is filled with linseed. These are such very small sewn-in pillows that we can then place on the SPINEFITTER with the heat in the heat, so heated. The Linum Pro is equipped with a PU coating so that the surface can be disinfected and washed off, and it is therefore wonderful to use in practices, Pilates studios or fitness studios. It can be disinfected and washed off after each use. The installation on the SPINEFITTER is very easy thanks to the Velcro fasteners we have. The SPINEFITTER is then inserted on one side, here on top on the other side. The last two balls enclosed by the simple Velcro fastener. We can use the linum now in the application, both before we do our exercises on it and after. Both have their justification. For before, I would speak that I warm up my structures before, already increase the blood circulation, and then possibly better come into my movement. For afterwards, however, I can also say that I would like to mobilize beforehand, have perhaps done sport beforehand, would like to mobilize afterwards, and then enjoy the warmth as an absolute conclusion, just to relax. Both have their justification and can be used either way. A common question we get asked is the SPINEFITTER a fascia roller, or is it kind of like a fascia roller? The SPINEFITTER at Sissel is an alternative to the fascia roller. We have our own good products in our range, the fascia roller and also the double ball. The SPINEFITTER is much softer than the fascia roller due to its flexible material and is more cuddly to the tissue, i.e. into the tissue. That's why I can mobilize my facet joints, my intervertebral joints more optimally. In contrast to the fascia rolls, I have a flat support, a longer support, so that I lie on it with my entire spine. But the pressure I put into the tissue is still punctual. We always take the highest point of each ball. This gives mechanical stimulation pressure into the tissue and can thus treat the tissue, the tensions, the adhesions. This is different from our products with the fascia rollers. There I have a flat contact surface and also treat the structures flatly. The advantage of this punctual treatment is that the stimulus transmission can be better processed when it is punctual in the tissue.